So I did my medication reconciliation with a 43-year-old white female. And of course we discussed that for this project I won't be stating her name or any private information like that. So we discussed first her support system. She lives at home with her husband and 2 high school age children. She said she has, quote, all the support that she needs to get to the doctor and take her medicine and pick up her medicine and things like that. So then I asked her about her health history. She does not have any known drug allergies. She said her last hospital visit pertained to a cholecystectomy, which occurred about 3 months ago. And she said 2 years ago she was diagnosed with hypertension and she was prescribed medication for that. She stated that the only other reason she ever goes to the doctor is she has recurrent sinus infections. I asked her when her last sinus infection was. She stated it was about a month ago. And she takes medication for those as well. So after we went over her health history, asked her to bring me out a list of her medications so we could go over them. Instead, she brought me a basket of her medications. She did not have a list. And in this basket, there were 5 medications. So we discussed what medications had she been prescribed versus what medications she's been taking. She takes the 5 medications the 3 medications that she is prescribed, and she takes 2 more over the counter. So there was no discrepancies there. Nothing that she's been prescribed that she hasn't been taking. When asked if she had anything else in the medicine cabinet, she stated ibuprofen and antacids for her husband. She said she likes to throw away medications that they don't use or don't need, which is a good thing. So, the first medication we pulled out was a prescription medication for her blood pressure, an ACE inhibitor, lisinopril, a 10 milligram tablet once every day. She also has bisoprolol, beta blocker, a 5 milligram tablet every day. She's also prescribed montelukast, 10 milligrams per day. And then she takes 2 over-the-counter medications for her allergies, cetrizine, a 10 milligram tablet, and Flonase. She says she does 1 square each nostril every day, and the bottle states that's 50 micrograms of medication. So of course, we discussed the first safety concern would be that she does not have a typed list of these medications. So we got together and wrote down the 5 medications, and the dosage and the frequency so that she could have that. And we discussed the importance of keeping a list. That way, if you get prescribed one medication or something gets discontinued, you can keep better track of that. The second safety issue I discovered was we were discussing her blood pressure medications, and she stated that she does not take her blood pressure medications the same time each day, which leads her to sometimes miss her medication. She'll forget it before she goes to work or something like that. So we discussed setting up a schedule for her to take her medications. That way she doesn't forget them, doesn't miss a dose, or doesn't take 2 in one day, anything like that. The third safety concern I found, we were also discussing her medications, her blood pressure medications, and she didn't know anything about any side effects. So we discussed making sure to be aware of those side effects and making sure to let someone know if she gets dizzy or if she's getting confused, having headaches a lot. Making sure she knows that she's at risk for falling. Make sure to let her healthcare provider know if any of that's going on so they can change a dose or see what's going on there. My patient was very willing and able to respond and learn and talk about her medications. And she said that she was completely willing and able to participate in her plan of care. So altogether, there were no discrepancies in her medication and what she had been prescribed versus what she had been taking. As long as she keeps to her schedule, she doesn't miss any medications. So that's all.